Okay, in our next segment, it's now with great pleasure I introduce the next presenters. Please bear with me. There's a lot to get through here on credentials, but our first presenter is Dr. Monique Gignac, who's scientific director and a senior scientist at the Institute for Work and Health and a professor at the Dalai Lama School of Public Health at the University of Toronto. Dr. Gignac's research expertise is in the areas of health and social psychology. Her research examines psychosocial factors like stress, coping, and adaptation, and their importance in understanding the impact of chronic episodic conditions on the lives of adults across the life course. Next, we have Dr. Cameron Stockdale, who is an executive leader who has been researching the intersection between leadership, change management, and strategic planning for over a decade. He has worked in a variety of different settings, including more than 25 years in the healthcare field related to ambulance services, home healthcare support, and more recently been appointed to the Inquiry Committee of the BC College of Pharmacists. For the past 2 years, he has been the CEO of the Work Wellness Institute, an organization whose focus is to research topics related to occupational health and safety to create inclusive workplaces for all workers. Next, we have Dr. Farrell O'Hagan, who is an associate professor in the Department of Psychology at Trent University and a registered kinesiologist. Prior to his academic career, O'Hagan held progressive positions in occupational rehabilitation practice and has developed, implemented, managed, and evaluated occupational rehabilitation programs for workers with a range of disabling conditions. O'Hagan's research includes work with chronic pain, heart disease, and mental health populations. Next, we have Dr. Emile Tompa, is a senior scientist at the Institute for Work and Health. He holds appointments as an associate professor in the Department of Economics at McMaster University and as an assistant professor at the Dalai Lama School of Public Health at the University of Toronto. He is also director of the Center for Research on Work Disability Policy. Through the CRWDP and beyond, Tompa has focused on creating collaborations between academics, community members, and other stakeholders, including policymakers, disability community organizations, and disability support program administrators. And finally, we have Dr. Rebecca Gewirtz, who is an associate professor in the School of Rehabilitation Science and an adjunct scientist at the Institute for Work and Health. Rebecca's research focuses on work disability policy, income security, and employment among persons living with disabilities, with a focus on mental illness and other episodic disabilities. She is particularly interested in building disability confidence among diverse employers, building more inclusive and accessible workplaces, and improving employment support services for persons with disabilities who face stigma in the workplace. We will have a short question and answer at the end of the presentation. You are welcome to type your questions into the chat box. Just click on the button at the bottom of your Zoom window, or you can raise your hand virtually using the Zoom tools, and then we'll call on you. Welcome, Monique, Cam, Fergal, Emile, and Rebecca.
Thank you very much. I will try to share my screen here, and I think I can do that. All right, hoping that has showed up for everybody. And let me get this in presentation mode. All right, good afternoon, everyone. I'm going to speak a little bit about organizational perspectives on disclosure, privacy, and workplace accommodation of episodic disabilities. I'm going to pick up on a lot of the themes, in other words, that we heard in the first session and the different questions and comments people had. This is part of a larger project called the ACE project, which is accommodating and communicating about episodic disabilities. You can see we have a large research team and a number of partners, and they include Realize Canada. We're funded by the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research, and have also received some money from Employment and Social Development Canada. Just a little bit of background to set us up. In 4 different Canadian studies with over 2,600 participants, about a quarter to nearly half of people had not shared any information about their episodic disability with their supervisor. And we know from research that people often delay sharing personal information until there's a performance issue or some problem in the workplace. We also know that decisions whether to share are not usually one-time events. These are ongoing decisions a person makes throughout their career, and they're complicated, they're complex, even when a person decides not to say anything at all. We've done a lot of research with workers, but there's less work out there with workplace representatives, with employers. And so in this study, we wanted to look a little bit at what workplace representatives who provide support to workers tell us are the key issues and challenges. So we called them our key informants. We wanted to look at their communication processes, ask them about them, and learn whether they feel their processes facilitate or sometimes act as a barrier to disability prevention and support efforts. This was a qualitative study. We interviewed people in person or by telephone, and we interviewed quite a range of individuals. We talked to supervisors, HR personnel, disability managers, union representatives, occupational health professionals, and labor lawyers. And we talked about general communication and accommodation processes, some of the successes and challenges, who should be involved, gaps in support, and so on. We also focused on both physical and mental health conditions, and often, as many of you know, people have both. And we used qualitative content analysis to analyze our data. This is just a little picture of who was in the study. There were 27 individuals, 3/4 of them were women. They fulfilled a number of roles, and in terms of the roles, it adds up to more than 27 because we had some people who had more than one role. And I just want to draw your attention to the fact that we had among our participants, 5 of them themselves lived with an episodic condition. And they also came from a range of different sectors. This looks very complicated. This is kind of the communication map that we developed after the study. I'm not going to go through this in detail, but to kind of orient yourself, the conversations we heard from people centered on 3 major issues, and those are represented by the colored boxes. So we had in the blue box some conversations about health conditions, similarities and differences among physical and mental health conditions, as well as cultures of workplace support. In the green box, this is where people talked about what happened in their organization when somebody communicated that they had an episodic disability. And there were 3 themes that arose there. And then we had this gold box, and we heard a little bit again about this in the previous session. What happens when someone chooses not to communicate? Do others notice? Do they say something? What's the process there? I don't have time to, as I said, to go through all of the themes, but I'm going to give you a little bit of a flavor of 3 of them. So we'll talk about cultures of workplace support, misgivings that people had about others, and casting disability as a performance problem. So when we hear a lot about workplace culture, and it's often very vague, along the lines of it's good to have a good one. What we heard about here more specifically were differences between what I'm going to call a medical model versus a biopsychosocial model. So in other words, workplaces tended to have implicit models that they applied to their organization and how they worked with workers. Medical models, and this is my label, not theirs, were common, especially in large organizations that were more familiar with injury compensation systems. And really the emphasis here was that health information needs to be validated by a health professional and closely monitored. Not all organizations took this approach. We also had what I'm calling a biopsychosocial model, which was really recognizing that disability needs to go beyond a medical diagnosis and needs to really include the workplace physical and social environment. And usually these models were spurred because of a number of challenges that everybody talked about. First of all, health professionals often were not able to provide the work-related information that was needed. They don't necessarily understand the workplace or the person's job. Workers were also noting that they couldn't always get timely or appropriate access to specialist care. And so that really delayed the process. And often a worker's condition didn't remain private, depending on the specialization of the health professional providing a note. So although they didn't have to put down a diagnosis and also didn't have to put down symptoms, if you get a note from a rheumatologist versus a note from a psychiatrist, already people are starting to guess what the differences might be here in terms of a person's needs. So as a quote, because in the medical model, because our third-party providers have that diagnosis, in most cases, it's a much smoother transition. I find return to work recommendations are more meaningful because they have the diagnosis. The most important thing is the diagnosis. A very different perspective, 75% of cases do not involve a medical practitioner at all for 6 months, up to they go to long-term disability. We're trying to accommodate people as opposed to manage their diagnosis, which is a complete and utter waste of time. You can't explain everything by medicine, by diagnosis, and you need to find some way to be fleet of foot and manage these, because if you don't, they go sour very quickly. And interestingly, that was a physician who was a medical director at a large organization. Another aspect of culture that we heard about was this: how do you promote fairness and transparency, but be flexible? So lots of differences here in perspectives. A lot of the discussion focused on this case-by-case approach, with some organizations feeling, well, this is really haphazard and arbitrary. You can't do this. Other organizations saying, the case by case is really the only way we can be flexible and individually responsive. Where an organization felt it was more of a haphazard process, they often were taking decision-making out of the hands of some groups, particularly supervisors and managers. The challenge here that we were hearing was that supervisors and managers said they were sometimes receiving too little information, and yet they had the greatest responsibility for actually implementing accommodations and trying to maintain staff productivity and morale, again, among the whole unit, the coworkers and the person who needed accommodations. We were also hearing that sometimes workers were getting left out of the discussions, which was really eroding trust. And so we heard some comments here, just some quotes. Supervisors aren't supposed to just make a side deal with the workers, because then you're sort of making side deals with everybody, but nothing is really documented. It's super important that it go forward to either the HR or health and safety individual. And again, a different perspective, it's impossible to capture in any sort of policies or procedures the degree of nuance you have to bring to bear on this sort of stuff. It isn't a one-stop. There isn't the one easy answer. There isn't the one fix. It has to be really individually tailored for everybody. And I think this sort of brings us to the next theme, which we heard quite a bit about, which was these misgivings that others had of one another. Everybody acknowledged the important roles that others place in supporting individuals with episodic disabilities, but comments frequently included concerns about other skills or their training or motivation and their involvement, when and where they should be involved. And so I've just put down 3 quotes here, lots of quotes about supervisors and managers not having the sort of knowledge upon which to base things and being colored by stereotypes or predispositions. By the way, everybody had negative comments about everybody else. The physician role, being to diagnose and treat and not being able to understand the workplace. HR, sometimes there was turnover in this group. In other research we've done, workers often feel that HR is there for the organization. They're not advocating for them. We heard concerns about unions being there for the group and not the individual. We heard concerns about co-workers who seem to have this make it or break it kind of relationship in this process. The final theme that I'll just touch upon is what happens when someone doesn't communicate. And this, as you know, came up earlier. Well, in larger organizations, sometimes formal communication is triggered by reaching a threshold of absences. So you find yourself in an attendance management program. You've been away a certain number of days. And the challenges that were raised here were that they can really pressure workers into disclosing something when people weren't ready, didn't understand their rights, didn't understand the process. it seemed to immediately recast disability now as a performance problem. So you're sitting talking about progressive disciplinary actions instead of support, and it really focused future discussions on these kinds of performance deficits and overcoming them, and not skills and abilities and support. So they had a tendency, although they weren't designed to be problematic in this way, to erode trust and confidence in the process. And we also heard from our participants that they felt that some workers, especially workers with mental health issues, were willing to admit to being a bad worker rather than risk disclosing that they had a mental health issue, because they just didn't know how to approach this and talk about this in their workplace. A couple of quotes to finish up here. It sets up an urgency at the beginning, because usually by the time the individual might involve a disability manager, they're quite high in the attendance management program. The employee in a lot of situations is not getting along all that well with management. And a union representative said, too often where we find out as a representative of the worker, it's because they're in a position of discipline and they have not indicated that they have an issue and have tried to sort of hide it. Then it suddenly reaches a point where now it becomes discipline. So just to highlight here what we found, I think this research really points again to organizational culture, but really needing explicit discussions about what we mean here, talking about what is our model, what's our approach, is it a more medical one, is it a biopsychosocial one, why are we doing this and what's working and what isn't. It also points to needing discussions around being consistent, balancing consistency with flexibility. I think, again, disability support comes from many individuals. We need more thought about who's getting excluded and included, and how does this play out in delaying the process or eroding trust. That when people don't communicate, sometimes we move into this progressive disciplinary approach. And that's a real problem. Those become real struggles for organizations and workers, obviously, when we recast episodic disability as a performance issue. And so all of us need to be advocating more with workplaces, engaging workplaces more in our research and in our efforts to move past this. I will just stop here. I know we're going to handle questions at the end. I just want to note that this study is available as an open access study, so you can read about all the themes if you're interested. And it's been mentioned, well, how do you talk about jobs? One of the new studies that we're doing is actually a new tool that looks at job demands and accommodation planning to provide people with ways to think about talking about their work other than and we have a website there. If you're interested, you can learn more. And we can put that in the chat, and I will stop sharing now.
Thanks so much, Monique. All right, Cam and Fergal, you're up next.
Hopefully everybody sees the screen. So I just want to say to Realize, thank you very much for the invitation to speak today. Hopefully Fergal and I will we'll work this out, and we won't step on each other's toes too much on our presentation here. But what I was really talking about, or what I wanted to talk about, was what our organization was out here on the West Coast. So we're the Work Wellness Institute, and some of you have heard of us. We were founded in 1985, and our objective was to lead evidence-based change, working collaboratively with academics, industry, and other community partners. And our goal at the end of the day is to really create safe and healthy and inclusive workplaces for all. So our mission is just that. And I think it sort of, we've worked with Realize for about 3 years now on a project called Harnessing Talent, where I think we've actually had some fairly significant success in that process of creating awareness and creating employers who really understand what it takes to be inclusive at this point. So, what we do as an organization, as I tried to advance this here. There we go. So what we do is we either do research here, or we find research, or we find experts in their particular field, and we take that knowledge and we do that translation piece. We take that information and we turn it into usable tools for organizations in the workplace to bring people into that community. We help implement those tools, and then we do an evaluative process at the end to see how successful it was. And that is the basis of some of our other research when we move forward. Interestingly enough, I think that we've done a fairly good job at the evaluative process and a number of our tools, the implementation of, and we've started to have a number of external organizations coming to us to really do the implementation, to sort of really look at that evaluative process and prove that programs are actually working. So from my perspective, that's successful. And we can hold up to our funders and say, hey, listen, the research that we did, how we translated that, and the tool, it's actually making an impactful difference at the end of the day. And so this is an overview of some of our current work to give you an example of what we do and how we do it. Dr. O'Hagan is going to talk about the return to work, the reintegration of employees returning from sickness or disability absence. And our process there is that Dr. O'Hagan is the primary investigator on that, but the organization, the Work Wellness Institute, we are supporting that work with some funding, and we are supporting that work with some internal resources of our research team ourselves. The I Can Work project is another example of the type of work we do, where the I Can Work team was stuck. They really wanted to apply for larger research grants, but every time they did that, they were told you hadn't run a pilot and there was no efficacy or evidence that your program was working. So we've provided some funding and some internal help from our organization to drive that forward to see if we can actually get some evidence or some support that will allow them to apply for larger research grants. And then lastly, this is a very good example of what we're trying to do more of. We've just received a fairly significant grant from the Future Skills Center, where we're going to be looking at gig workers living with a disability, exploring their experiences and improving sort of their health and wellness from that perspective. And that project there, I am the primary investigator on that, and we'll be using, utilizing a lot of resources of our internal research team. But because we work collaboratively, we will be reaching out to a number of people to be advisors and collaborators on that. And there are some familiar faces on the screen here that are actually part of that project at the end of the day. So these are the outcomes. This is what when we talk about those tools that we create, because we're a nonprofit, these types of things are available to everyone for free. So many of you are probably familiar with our webinar series. I think we hold about 3 or 4 a month. I think the next one that we're doing is actually on creating a physical workspace and what makes a healthy workspace. We have our Thoughts to Inspire series, which is a podcast that we're producing where we interview experts in their field to come up with sort of new and different ideas. We have a number of conferences. I think we're doing 3 this year, the next one being in June. From all of our webinars and all of this content, we produce downloadable infographics that if you go to our website, you can download for free and utilize as you see fit. We have a research portal now with 300 academically reviewed articles. So we go out and we try to curate what the best and most current information is if employers want to read it. We have a speakers bureau where there are a number of people. I think we have about 28. That if you're looking for a speaker on a particular topic, you're more than welcome to go there and we'll set up that relationship. And we also have a mobile app where all of that content is actually available to you as you're walking around on your phone. So those are the kind of programs that we're developing, and there'll be much more in the near future, but that's what's out there and available to you. And then last but not least, if you want to get involved with our organization, our research ideas don't come from me. They don't necessarily come from the team. It comes from people who are involved with the organization. It comes with our National Advisory Committee. And if you are interested in sitting on any of those groups, feel free to reach out to me. We also have all kinds of social media channels where you can follow along with us. And with that, I'll turn over the floor to Dr. O'Hagan.
So I'm going to follow up Cam's comments with just to sort of fill out one of the projects that he discussed there, a knowledge transfer project that I'm working on heading up, focused on sustainable return to work. And so what I'd like to do is just describe the project a little bit, explain the process we're following, maybe talk a little bit about the challenges of doing such a project, and hopefully solicit some involvement with the project. So this is a partnership with Work Wellness Institute and my institution, Trent University. So when I was approached to work on this project, the general scope and theme of it is focused on a cross-discipline, cross-sector, work-focused approach in the development of a framework to enhance health-related quality of life, workability, and return to work among persons living with disabilities. So in the first instance, we needed to sort of scope this and come up with some specific deliverables that might help our stakeholders, and identifying who our stakeholders were was one of the initial challenges. And in talk with Camilla at the Institute, we arrived on focusing on the problem of sustainable work. And my research background is in occupational rehab, and we've come to characterize sickness absence in terms of its phases or transitions, where people leave work, they engage in a process of rehabilitation and recovery. There's preparation to return to the workplace. There's a return to work process, but also sort of an event that takes place, and then there's the whole process of staying at work. And there's been a lot of attention placed on treatment and return to work phases for folks with sickness absences due to mental health or physical health problems and episodic disabilities. And we know that these transitions can be cyclical. Like people, they cycle in and out of the workplace following the onset of a health condition. And sustainability is really an important part of the picture that hasn't been, maybe hasn't received as much attention as it should. So we kind of boiled the project down into one that focuses on knowledge translation. So taking the academic knowledge that we've gained in terms of what helps people stay at work and move it into workplace practice. Workplace is really the hub of where things go on in terms of whether or not people stay at work. And so the focus that we've come to is an applied research paper that addresses the above theme through a broader lens of sustainable return to work, and informs the required elements and considerations of developing an effective framework positioning return to work initiatives for success over the long term. So I'm just going to talk about sort of the people, and the process that we're going through. I'm working as PI on the project. We have Julia Goyle from Work Wellness Institute. She is the research coordinator. We've established a research advisory committee consisting of Deanna Lanaway, who has a lot of expertise in HR, Melissa Egan, of course, from Realize, who has tons of expertise in this area, Dr. Emil Tompa from the Institute for Work and Health, and from MAC, Damacour, who's a PhD candidate at St. Mary's in Halifax, and working with Arda Day out there, and Christina Mayu at McGill, who's doing some really interesting work on cancer and return to work. And we've got an RA on board from Trent here, Aaron Vine. So we're contributing as well to along with sort of the deliverables of the project, we're sort of contributing to the training of highly qualified personnel in research. And Aaron is very interested in organizational psychology and in this area. Our process in terms of how we're working through the project, we're first conducting a needs assessment, a fairly thorough way, a literature review, environmental scan of existing supports and resources for workplaces, focusing on sustainable return to work, stakeholder consultation involving focus groups and survey. We have a research advisory committee conducting key informant interviews. We then move to resource design, which we will be informing with theory and evidence collected along the way, including like the practical evidence, very importantly, from stakeholders. And then our intention, although we're not quite sure where we're going to land with the exactly with the resources, is to create something that's open source, accessible, and engaging and interactive for workplaces in order to support sustainable return to work. And I see some of the products coming out of this as, potentially an inventory of current resources that are out there, a literature review and document, sort of a supporting document coming out of the academic literature, and then an open source web-based resource for workplace stakeholders, the shape of which is going to be determined through the project. Some of the challenges. So with a project like this coming in, you might imagine just difficulty scoping the project and really targeting the problem and population. And identifying the approach, I think, is a big challenge here as well. But I mean, that's why, this research is really about the needs of workplaces in being able to support workers. Stakeholder participation is typically challenged, getting people involved. We hope you can help us out with that. We're working on a fairly short timeline as well. Our resource needs to be developed by the end of September. So we're moving along through things. So I'm happy to address any questions you might have about the project, and you can help. So we will be conducting focus groups and a survey, focusing on what challenges are there for staying at work, what resources are available to support workplaces, and sort of what formats and designs are most helpful. So I'll wrap it up there, and
Thanks
thank
so
you
much
for your
to both
attention.
of you. Thank you very much, Cam and Fergal. Really appreciate you adding to this conversation about research. And so our last presenters of the day are Emile Tampa and Rebecca Goberts. I'd like to invite them to present. You should be able to share your slides at this point.
I'll do that. Well, thank you everyone for this opportunity for us, Rebecca and I, to present a little bit of our new idea, which is a social innovation laboratory that was recently funded by New Frontiers. An idea stands, as you can see from this slide, inclusive design for employment access. So in this slide, I'm providing a bit of background on the transformation stream funding envelope from New Frontiers, which is the source of our funding. And I'm presenting it here because we want to keep it top of mind and stay true to our raison d'etre. Our idea is focused on transforming workplaces and labor markets such that there is equality of opportunities in careers, jobs, and work for persons with and without disabilities. And our approach is focused on what we describe as demand-side capacity building. That's a term that we have coined to describe building employer capacity to be disability confident. And so to date, the focus has really been on supply side interventions and on skilling up, and on responsiveness to individual accessibility needs. And those are indeed important, but unfortunately, engagement in the labor market has remained substantially lower than for persons without disabilities. We have some data here, as you can see, from calendar year 2017 for persons with disabilities. It's 57% compared to 75% for working age persons. And earnings have been substantially lower as well, averaging $34,000 per year versus $40,000 per year for persons without disabilities, for those who are working. Also, challenges are compounded for people who are also part of other marginalized groups, such as gender identity, sexual orientation, indigeneity, and racial identity. And COVID-19 has further exacerbated the disparities, as we've all heard about. Some numbers that we have estimated for calendar year 2017, the output and productivity losses are 3.2% of GDP, or $62 billion. And the total cost of exclusion across all social roles, we've estimated at 17% of GDP, or $338 billion. So clearly there's a huge wasted human potential here. So, and we feel that there's an urgent need for a new approach, because employment is transformative for people's lives. You know, work, employment, and careers are fundamental to most people. It gives them autonomy, agency, purpose, structure, and quality of life. And some would say that employment is a human right. So in our social innovation laboratory, we are drawing on knowledge from disability studies and systemic ableism, as well as Article 27 of the CRPD. These have all served as foundations for our idea. We're focusing on skilling, in the past, as I mentioned, there was skilling up workers, getting them job ready has been an important part of developing the opportunities for persons with disabilities. But employers, even though they're ready, willing, and able in some cases, they still struggle to accommodate persons with disabilities because they lack disability confidence. So confidence requires knowledge, ability, resources, and to build disability inclusion in all of the organizational activities. So we have a unique opportunity here to make breakthrough change, but we need a new approach. What is our solution? As I mentioned, we're focusing on demand-side capacity building. We've gathered together a multidisciplinary, multi-sectoral, partner-driven social innovation laboratory. We've organized it around what we describe as incubator hubs that are co-led by a researcher and partner representative. And these incubator hubs, they're listed here in this diagram, serve as entry points for inquiry. There's 3 core hubs, one on workplace systems and partnerships, another on employment support systems, and a third on transitions to work and career development, and then 2 cross-cutting hubs. One is on inclusive environmental design, which we want to go beyond just the built environment, and then another cross-cutting hub on disruptive technologies and the future of work. I'll pass it on to Rebecca at this point.
Hi, and so I am going to talk about how we're going to work within the hubs. We have basically developed a 5-step methodology, and although it looks linear here, it's really meant to be flexible so that we can enter the process at any point, depending on what we're working on. So in many cases, we'll start with this rapid synthesis of existing knowledge to ensure we don't reinvent what's already been done. We will engage in extensive stakeholder consultation. And then importantly, we'll go through a process of rapid prototyping through this co-design, user-centered, process-driven by partners to draw on their field knowledge. And that's followed by implementation, evaluation in the field to understand the context in which things work well or where things don't work well and why. And lastly, but importantly, scaling up these local innovations with assistance from our partners. So what's important here is that we may, depending on many of the projects that we've identified, will start at various points depending on where we enter the process. And many of the projects that we will be working on, the initiative is cross-disability, but definitely projects will be focused on episodic disability and intermittent work capacity, knowing that these are particularly challenging issues in the context of the workplace. Okay, so going to the next slide. Here we're just showing how we've developed an organizational structure and identified how people will work in key roles. Our focus, we have substantial knowledge mobilization and partner engagement plans to facilitate uptake and the impact of the solutions. And we will be working with extensive co-collaborators and partners across Canada and internationally. This initiative is very much interdisciplinary and intersectoral. So really important. There's multiple ways for people to get involved, multiple initiatives that will be operating at all times. So for all of you on the call, if you're interested, please do get in touch. Going to the next slide, we have, we've developed, so we're just getting off the ground here, but we have developed some preliminary performance measurement frameworks that includes outputs, impacts, and audit measures. We need to be transformative. We're looking for ambitious targets. The idea here is that the solutions that we create and evaluate need to really advance our agenda and make a difference in making Canada a leader in inclusive employment. So we're really looking at some transformative outputs. We have 6 years. We need to show change and progress at the 3-year mark. So going to the next slide, we have, the initiative is Pan Disability, but there will be a focus on episodic disability because we've identified that skilling up employers, we really need to pay attention to diverse groups of persons with disabilities, especially those who face particular stigma in the workplace. And this absolutely involves people with episodic conditions and intermittent work capacity. So our focus is really on improving employer capacity to create more inclusive and flexible workplaces. And that will have, for sure, undoubtedly benefits for people with episodic conditions. So just going to the next slide, we want to highlight our extensive partners across Canada and internationally. And you'll see that we, actually that will be the next slide, but this initiative cannot occur without collaborators and partners in various sectors. And we're really excited, and obviously Realize is one of our partners, and we're really excited to be working with all these partners. And just going to the last slide that we have for today, the last one, you'll see that we have partners in research, partners from the disability community, partners in labor and industry, service, and government. So to do this kind of project, to make evidence-informed change, we need to work with people across sectors and across disciplines. So we're really looking forward in the coming years to be sharing some of the results from this initiative. But if we have time, we do have a short video. Are we playing that, Emil, or?
Sure, we can if we have time.
Hello, my name is Tammy Yates, and I am the Executive Director at Realize. I am absolutely delighted to be sitting on the Stakeholder Advisory Committee. I look forward to the great work that we are all going to do together.
Hello, I'm Elizabeth Kwan from the Canadian Labour Congress that represents the 3 million unionized workers in Canada. The post-pandemic recovery must include persons with disabilities, especially those with intersecting inequalities such as Indigenous, racialized, and women workers. That's why Labour fully supports the Inclusive Design for Employment Access proposal.
The Canadian Chamber of Commerce is the voice of Canadian business, representing 200,000 businesses across the country. We are focused on an inclusive recovery. We would be delighted to serve on IDEA's Advisory Council and help identify practical solutions and amplify best practices.
I'm Bruce Bonihady, and I'm the inaugural director of the Melbourne Disability Institute at the University of Melbourne. Prior to joining the university, I was chair of Australia's National Disability Insurance Scheme. I'm also the parent of 3 adult sons, 2 of whom have disabilities.
My name is Michael McDonald. I'm the manager of the Health Services Department at Jazz Aviation, a regional airline in Canada. My role is twofold, right? Because as a person with a disability, I'm going to make sure that I'm out there sharing the lived experience perspective. But I'm also very, very aware of the context in which the employment is going to happen.
I just graduated from high school. I'm in Charlotte Apex. My job is cleaning stuff like sanitizing, early cans, and evening garden center.
So if I could just say one more thing is that one of the first things that we're doing is setting priorities and advancing our research, setting the research agenda. So now is a particularly good time to get involved and make contact with us.
Thanks so much to all of our speakers on this panel. Really appreciate it. I am fully aware of the fact that we have just reached 3:30. So understand that some people may need to leave at this time, but want to open up the opportunity for folks to engage in discussion or ask any questions of our last 5 presenters. Okay, there's one in the chat here. I'm just going to read it aloud. Are there incentives provided to employers if they hire or accept applicants or employees who have episodic disabilities? I recall that in Manitoba, there was a program, Retrain Manitoba, which offered a maximum of $75,000 for employers providing technical and behavioral training programs to their employees. Does anybody out there have any information that they would like to provide? Any way to answer this particular question?
Perhaps I'm not aware of incentives specifically around intermittent or episodic disability, but certainly there are financial incentives in various forms for employers to hire and accommodate people with disabilities more broadly. So it is a good question to be asking, how does this work for people with episodic disabilities? And that's where I'm a bit stumped, actually.
Yeah. All of the information that I've got in my kind of brain as well, based on my experience, Rebecca, is the same, right? It's that there are programs broadly defining disability that may provide that kind of incentive, if you will, but specifically related to episodic disability, not so much. Anybody else want to weigh in on this one?
There's a comment in the chat from somebody from Employment Ontario because of the details.
All right, so Samantha from Employment Ontario says, I'm the coordinator of an Employment Ontario service provider, and we do offer some financial incentives for employers to hire barriered folks, which does include people living with disabilities. So it's likely folks with episodic disabilities would fall under that. So if there's something in Ontario related to employment at that kind of particular service provider, you may find something similar in Manitoba, but you can also reach out to me and we can do some of that research together. I'd be happy to do that with you.
I would like to mention, Rebecca, you're probably going to say the same thing. Rebecca and I, with some of our colleagues, have been doing research on financial incentives across Canada about and just investigating how they're packaged, because they take very different forms. You know, they can be in the form of wage subsidies or some providing cost relief for some of the wraparound supports that are needed, or accommodation supports and things like that. And they're offered for different periods of time until the person reaches hopefully sustainable employment, but oftentimes they're a bit much shorter than that, like 12, 13 weeks. usually through employment agencies who get the funding that are focusing on employment of persons with disabilities, matching them with employment opportunities, trying to find those matches, helping them get job ready, helping employers be disability confident, and whatever services are needed to make that happen, often are packaged in different forms of financial incentives. Rebecca, did you want to add anything there?
Only that I think that, like many different policy structures, they are often designed with this image of disability as a stable entity. And so asking these questions around how do people with episodic conditions fit within these structures is actually really important. And I'm really glad the person wrote that in the chat, so I can't see who it was, because it is making me think a lot right now about the need to really revisit that in terms of financial incentives.
Thank you both very much. There are a couple of folks in the chat who are exchanging information, which is exciting. But there is one last comment that says, Emile and Rebecca, what would be the best way to get in touch if people are interested in the Inclusive Design for Employment Access project? I would also like to put that out there that Fergal O'Hagan has put out his contact information into the chat as well, if you would like more information on his project. The one that's in partnership with the Work Wellness Institute and Cameron Stockdale as well. All right, folks, just to make sure that we stay on time at this point, I'm going to hand it back to our intrepid moderator, Brian Ellison, just to close out the day.
Okay, thank you, everyone. Thanks for your important insights.